Hospitals should be hiring more nurses. With COVID-19, an increase in patients in critical care has caused a shortage of nurses. Leanna Matt McLemmon with the CIDRAP News states that with the third U.S. pandemic wave, nurses and other staffing shortages are sweeping the country. On the left, you can see that there is a higher ratio of patient to nurse than there has been in the past. This is because as of November of 2020, the nurse to patient ratio went from the recommended 1-to-1 to a 1-to-4. In the right picture, it can be seen that there is a spike of patients that are coming in that are hospitalized with COVID-19. This means that they have to be in a isolation room and cannot be mixed with other patients that do not have COVID. Are hospitals budgeting enough money for nurses? Hospitals facing financial uncertainty have sought to reduce nursing staffing as a way to increase their profitability. Authors of Healthcare Managed Rev found that nurses are expensive to staff. They determined that the hospitals will gain more money if they reduce their nursing staff. However, they have also seen that nurses are one of the most important staff members in the hospital setting. They are responsible for the quality of patient care and the outcome of their patients. The authors also found that the hospital will then have a better financial performance in a competitive market if the nursing staff is at a level that is effective for that hospital. They are also adding tasks to what nurses are having to do. Nurses have to work longer hours with limited access to personal and protective equipment, which is their PPE, and have to change tactics. They are asked to wear a certain type of mask, but then they are not given what those masks that they are needed. Certain cities are in need of more nurses than other cities. Cities like Seattle, New York City, and San Jose need more nurses because of the number of people in that city. This means that there are more people getting sick and need to be hospitalized and taken care of. Increased caregiver workload and declining number of RNs threaten the quality of patient care and safety. Researchers have found that they are failing to identify infections, pressure ulcers, medical errors, and patient falls. Not only do hospitals need more nurses, they also need the supplies that will keep those nurses safe from the virus and also keep other patients safe from the virus. Hospitals need more nurses in order to provide the best possible care for their patients.